probably the most common question I get because it's the most heavily marketed. It's hard not to be listening to the radio or mass media or newspaper and not hear about clinics that are basically offering something that we're going to call Shockwave, penile Shockwave. This is a very lucrative venture for these clinics. These treatments of Shockwave are starting to be offered. They had been historically offered. I will offer them occasionally to a patient just because there's very little way to get around the fact that patients hear of this miracle treatment that's going to cure your problem. Who wouldn't want that? Of course you would want that. The problem is that it generally doesn't work. There are different machines and classes of machines. There's basically pneumatic devices. That was the original ones. They definitely don't work. There's now some piezoelectric machines similar to what we use for kidney stones. Those are called class 2 and class 3 machines. And they have a little bit of weak data that suggests, and it's old data, hasn't really been updated for 10 years, that suggested that, hey, maybe this helps a little, but generally it helps the man where pills already work. So the only data out there that says it's going to help someone is in patients where taking a pill that's cheap now would work. And so you have to ask, why would you do that? It's generally patients that are just looking for that miracle cure. And I don't have the best impression of those clinics because they're charging men upwards of $6,000. They will do that with anybody, certainly men they know it's not going to work well on. I've had patients, I've removed their prostate. There is no way that's going to help them. And they're garnering their paycheck to pay for this. Generally, a course of this is $6,000 to $8,000. If I have a patient, and it's a rare patient that comes in, they have the money to spend, I'm going to make sure it doesn't cost $6,000. I think most urologists are going to, maybe if they offer it, charge $3,000, $2,500. But it's still a lot of money for a lot of people. I will say to someone, my main recommendation is just to take pills. But if you really have the money to spend, you're ready to have it not work for you, and you just need to feel as if you tried it, it's something we try to offer for those men. And that's why many urologists do offer it. I find it to be ethical to offer it as long as patients go into it with the understanding that it's not likely to work. And their better option probably is just to accept the fact that they need to use pills.